Hi, good evening, everybody. Welcome to the webinar series of the Mazumdar Shaw Medical Foundation and the BioNest, which is being operated in partnership with Wilgrow, BIRAC, and Narayana Hridayalaya. A couple of lines about the technology business incubator itself. This is the country's only technology business incubator that is based within a corporate hospital group, and this gives access for medtech entrepreneurs to be co-located in a hospital environment, which gives them and inroads into the clinicians, the hospital infrastructure, the Translation Research Center, which has molecular biology facilities, and co-create your solution in coordination with the clinical challenges. In today's webinar series, where we have a very grateful guest with us. We are talking to Ms. Amira Shah today, who's the promoter and managing director of Metropolis, which is a reputed chain of pathology labs and is rated among the top 1% laboratories across the world for their quality systems and protocols. Ms. Shah has led Metropolis into the front lines of COVID testing in India, advising and engaging with the Indian government for a plan to the response to the pandemic. Metropolis has 5 approved and audited COVID labs across the country. She has been named among 50 most powerful women in business by Fortune India and Business Today in 2019. Ms. Shah is recognized as a global thought leader in healthcare industry. She has also played an instrumental role in changing the pathology industry landscape in the country, from being a doctorate practice to a professional corporate group in an extremely unregulated, competitive, and fragmented market. Please help me welcome Ms. Shah.
Thanks so much. Happy to be here.
Thank you for your presence, ma'am. And I'm sure this will be an enlightening interaction for all our entrepreneurs and other we have today in this webinar.
Yeah.
Any opening comments that you'd like to make?
No, I think there's never been obviously a better time, I think, to be an entrepreneur in India. There were 20 years ago, I know when I started building Metropolis, it was a very different situation. Funding, financing was not easily available. These kind of platforms or incubation ecosystems were not there at all. So I think from a perspective of entrepreneurship being a cool thing to do, where your parents are happy about it, funding, financing being available, mentorship ecosystems being available, this is the best time. Where the Prime Minister is also talking about startups, being the it thing. So I think India and healthcare needs huge amount of innovation to solve the challenges that we have. And I believe those innovations can only come from grassroots level up. They will almost never come top down from established corporates and companies who are focusing on bigger challenges and maybe more policy driving. So I'm just happy to be here. I've always been in support of entrepreneurs who are starting and building, and I have my own platform called Empowerers, where we help women entrepreneurs, scale and mentor their businesses as well. So hopefully can be some help to some of the guys here today.
Indeed, we look forward to this interaction. Let me then begin with the first question. We all know the success of Metropolis that's today, but how did the journey start 2 decades ago? Maybe you can spend a few minutes giving us that inspiration to some of the aspiring entrepreneurs here.
So as we know, all entrepreneurial journeys start with finding a problem to solve. Without which you really can't, the seed of the idea has to come from there. And I think the problem that needed to be solved 2 decades ago now, I was 21 at the time, and was that there was really no standardization. There was no chain of pathology in the country. And the reason why you need a chain is because, we do almost 4,000 varieties of tests. And from an infrastructure perspective, that works best in a hub and spoke model where you're not replicating all 4,000, testing in every city of the country. But through a hub and spoke model, you work in a way where samples get collected in one city and then brought to a hub where the testing happens. And therefore that gives you economies of scale to be able to actually make it viable, commercially viable from a revenue model perspective. So the problem to be solved was really about building scale, and because that brings in significant benefits in pathology. And how do you do it while building a services infrastructure which is front end and therefore needs to be fully standardized because your brand needs to be represented with one experience? And how do you really move a industry which has been so used to individuals as the stars, the doctors as the stars, and how do you institutionalize a brand and build a corporate brand behind it? Because actually that's something that usually traditionally doctors don't want at all. They want their name to shine through, and they don't want to be in an institutional brand, and that's even the case today. So I think these were the challenges of really building this organization, and we started, as you know, from just one lab, and have gone to where we are today at about 125 labs in 5 countries and about 2,500 centers. The journey has been a roller coaster. It has not been a smooth journey at all. Like most authentic entrepreneurial journeys, there have been all kinds of blocks and obstacles in the way. And I think that's been also the joy, to be honest, of the journey. It's kept me on my toes. It's kept me, watchful, paranoid in some cases, which you have to be as an entrepreneur, and not ever be able to be just complacent about saying, okay, I've now sort of made it. Every year has brought its own challenges, and that's been fun.
Yes, indeed. The adage usually is behind every successful man, there is a successful woman. If I were to turn this adage around in your case, who would be the inspiration and the person behind your success? What would you correlate that to?
So I would say, at the moment, this is a constantly evolving answer, I would say, because it's no one point in, not over 20 years can the answer be the same. I think there are different people that come into your life bringing different things and different learnings. I would say at this point of time, the answer is three men. One is my father, who's the pathologist and was the one who actually brought the science and the medical knowledge to this platform. And therefore, we were able to, me not being a doctor, that was hugely, immensely useful. And having his knowledge base as something to fall back on really gave me the safety of being able to focus on the fact that I could focus on taking something, the knowledge that was already there, and really scaling it. So I would say definitely him to start with. I would second is my husband, who's been, he has his own business. He's very entrepreneurial, does his own things. But I have never seen a man of as much resilience and as much persistence as him. So when the times have gotten really tough, and there have been many, as I mentioned, he has really given me the strength to be able to just keep going, even when your die are down and your chips are down, and you just keep going and looking at every day as a new day, and keep working at it, and just keep working at it with your head down. And usually when you do that, good things emerge out of it. So I think him definitely for that. And third, I would say recently, the most new addition to the team is my son, who's now just 9 months old, still a baby. But I would credit him for providing me in this year with the space to really relax when work gets tough. And honestly, it's as Ruth Ginsburg actually said, and I really identified in that article, that work and family, and work and kids have actually each become a respite away from the other. So when I'm at work and I've had too much of it, my baby Karma is there to give me the de-stress, and when I'm with him, my work is there to give me the intellectual stimulation. So both together work wonderfully.
Well, indeed, Ruth Ginsburg and Ms. Shah will inspire more women entrepreneurs for the country. And like you said, your father, your husband, and your son, may this inspire more men across the country and their families to support wannabe entrepreneurs.
But I have to add here that I know
Yes.
I had to mention men's names, that's why I did that. But the real inspiration is a woman behind a woman. And by the way, that's usually true in reality, because the only time, I think mostly, not the only time, but mostly daughters go on to pursue their dreams and their ambitions and push themselves hard when they see their mothers doing the same. And that is 100% true in my case, because growing up, I always saw my mother work extremely hard and really role model work ethic, passion, pursuit of her own knowledge. She's a doctor, she's a gynecologist who does a lot of social work. And I saw her play out every single one of the values that she taught me. And as we know, you can't, if you don't practice what you preach, the children learn nothing. In our case, because she practiced what she preached, it was very easy for us to follow suit.
That's great to hear. You mentioned one challenge, which is about in healthcare, doctors generally want to stand their name out, and in which was a challenge in terms of institutionalizing a practice or a technology. So, if you were to draw out a few more lessons, or particularly that challenge, how did you overcome that? What were some systems and processes or some approach which help you, grow beyond a individual doctor or a practice? Some tips there.
Yeah. Look, I mean, I think the first thing is the selection of the partner, because, across the country, there are, many doctors who are, very good at their craft, very knowledgeable. But in some cases also there is very high ego. And that also results in them not ever necessarily having the humility to understand that collaboration is the way forward. And therefore, we just avoid those kind of partners because we know that whatever you try to do, if unless it takes two hands to clap, and unless both parties see value in collaboration and learning from each other, that's not going to happen. So we just avoid those partners completely. We usually like to focus on doctors who believe that they've done really well and they're proud of what work they've done, but they also believe that they have something to learn, and therefore are interested in learning from us as we learn from them. We look for people who are reasonable. We look for people, obviously, who are knowledgeable and competent. But it's also about us approaching it from a partnership approach and recognizing that doctors have very different skill set than when you find in an organization institutional, where doctors have been trained like lawyers or like chartered accountants or like any professional to have depth of knowledge in one field. And usually business people like myself have been trained to look at things from breadth. You try to look at 20 different things at one time, weigh all the balls and then make your decision, while all professionals are trained to go into depth, which is why they are masters of knowledge. And usually business people are never kings of any one thing, they're jack of many things. So I think understanding this divide and thinking how can you bridge it, and therefore each decision will be approached from two different perspectives, and recognizing that both bring value and contribution to that opinion, as long as you have a common goal. So setting that common goal, and then trying to find different ways to approach the problem, I think has been our way of really working with doctors who we find to be reasonable and who want to collaborate.
Great. So the last 8 months have been nothing short of unreal, surreal world for all of us, and specifically for the healthcare and the pathology sector. But what are some learnings and opportunities that you would point out for wannabe entrepreneurs in the area of pathology?
Look, I think pathology as an industry is obviously growing very quickly. Scaling services is quite a challenge. I would definitely recommend to entrepreneurs to look at more product oriented solutions rather than focus too much on services, because services requires a deep gestation period, very long gestation period. And as a startup company, you either have to have significant amounts of capital that allows you to have that gestation period, or you have to have incredible amount of patience, not looking at building something in 5 years and selling it, or going through multiple rounds of financing. That won't work in services. So I would encourage people, if that's the mindset, to look more on products. And if you actually look at the entire healthcare space, again, there are brands which are quite deeply entrenched in certain areas because they have medical and technical knowledge. But there are a lot of areas where, for example, there is very little innovation that's happened. So it could be as something as the containers in which we collect samples, for example. There's been very little innovation that's happened in many years to come. It could be sample transportation. Again, it tends to be very expensive or nothing available, at all. It could be automation for healthcare. In healthcare, almost 70-80% is manual. Nothing is automated. You don't have anything digitized. You don't have anything, people don't even have computers. If there are SaaS models that can be built on really digitizing and automating a lot of the fragmented industry, I think that's an opportunity as well. Because 80 to 90% of healthcare industry continues to be unorganized. And when I say unorganized, they tend to be very small, in nature. The Medantas and Narayan Rajalas and Metropolises of the world are, the very small numbers in terms of the overall contribution. We are the organized industry is only about 15% of the total market. So, I think there's definitely opportunity to do things in the unorganized space. But again, there you've got to be focused. You've got to be clear as to who your customer segment is, because otherwise you get lost in the hundreds of thousands of nursing homes or hospitals or labs or whatever. So these are some of the thoughts. And of course, there's a long list.
Indeed. Would you say what is the right model for universal health coverage for India? Would you equate that to building a large number of hospitals and beds, or what in your definition, using technology, how should India move towards universal health coverage?
Firstly, I think we have to remember that universal health coverage is not about only tertiary healthcare. There's three pillars to it, right? One is preventive healthcare, one is second is primary healthcare, and third is tertiary. Because private sector has invested so much into tertiary healthcare in terms of big hospitals and infrastructure, people are actually skipping preventive and primary and going straight to tertiary healthcare as a solution. And that just doesn't work, because India does not produce the number of doctors required, or the number of nurses required to be able to provide tertiary healthcare to all other states. Right now, I feel we need to make a blueprint of a very integrated healthcare plan if India genuinely wants to take care of her children in terms of providing healthcare for everybody. And that is going to require addressing all three parts of it. And I'm also very clear that this cannot be done by public sector alone or private sector alone. As much as the government, I'm sure, has the capability to handle everything on their own, there is no need to. If anything, COVID has taught us this year, it's that collaboration is the way to go. Vaccines would not be able to come out this fast if there was no collaboration. Medicines would not be able to come out if no collaboration. And when we do collaborate, look what we're able to do. We're able to bring a vaccine out in 6 months of time, which normally takes 10 years of development. So I think if we are all able to get over our hang-ups of having to do everything on our own and actually learn to collaborate, public and private sector, and even within private sector, I think there is much more that we can do in terms of integrating preventive, primary, and tertiary healthcare, all supported with the records and the data analytics and the information that it ties all these experiences together for a patient, right? And obviously all of it backed by some sort of provisioning, which can be a combination of part private in terms of out of pocket. For below poverty line, obviously, there is something like Ayushman Bharat and other insurance schemes available. But again, it has to be a combination of different things for different segments of society. I think this mantra that everybody keeps talking about is just make it more affordable, reduce prices, is not the solution, because at some point you will not be able to reduce prices. And when you start doing that, it's only going to cut your quality. So we have to find innovative ways to maintain, to have higher quality and maintain prices at a lower level, rather than keeping on only pushing the envelope as far as reducing prices. That's not a solution long term. So these are some of the things that I believe if we do, we can actually skip over the phase of only making brick and mortar, but actually using technology, robotics, AI, in more significant ways to actually look at providing universal healthcare, which is more technology based rather than the old world of healthcare, which is very traditional and brick and mortar based.
So the mantra, if I were to summarize, about bringing in collaboration, not just public and private, but within private parties too, a lot of collaboration. That's what will help us drive towards universal healthcare. The second one, if I were to capture, was about not looking at just driving affordability, but looking at it as an optimization of what innovation that brings in to drive cost, and not purely from a cost lens alone. That brings me to the next question, which is very current in terms of how a lot of the countries are moving towards vaccinating all their citizens. What are some areas of innovation that entrepreneurs should look at over the next 1 or 2 years when all the countries are moving towards vaccination? What are some technologies or areas of innovation with vaccines you would see?
So, I mean, clearly, as we know, I think the Indian government, I don't think is moving towards universal vaccination, from what I understand. And therefore, while we are going to have a certain number of dosages available, there is obviously going to continue to be a situation where all Indians have not received the vaccine. So, on the vaccination side, there are obviously opportunities as far as vaccine storage, vaccine transportation, actually the actual implementation of it, as far as the data record management of it, how do you monitor who's received it, who's not received it, tracking and a surveillance of the entire thing. And then obviously there will be the follow-ups required to the vaccination. We really don't know how long the vaccination is actually going to immunize people. As of now, it's expected maybe it could be 6 months to 2 years. But that also means that this is going to be a recurring event that needs to probably happen, assuming corona is going to be around for the next 40, 50 years and not going to disappear, like many influenzas and any other viruses have been. So this could be an opportunity from an entrepreneurial perspective, which is recurring on an ongoing basis every year or every 2 years, where somebody needs to get sort of the vaccine for COVID. So I think it's an investment potentially worth doing, assuming that there is clarity from the government that this will be seen as a entrepreneurial for-profit activity, and not be seen as something which must be done from a CSR perspective, because traditionally in healthcare that seems tend to be the perspective of government bureaucracy, that anything in healthcare must be CSR and noble, and therefore free of cost, which frankly is a completely unsustainable, obviously, for a country like ours with 1.3 billion people. Government, I think, will not be able to afford to do it. So obviously, there's no chance that private players will be able to do it.
Sure. In the first part of the conversation, you spoke about how the gap in the diagnostic industry was very individual players, and that gave you the space to expand to a chain. So similarly, and the challenge there was clearly beyond building systems and processes beyond one-star clinician. What were some other challenges in institutionalizing a brand? And if you were to draw a parallel to how medical device startups and AI-based startups in healthcare, what are some challenges that you see that they need to go after, and how some of the lessons based on Metropolis journey that you'd like to share?
I think the challenges in healthcare really tend to be more driven around adoption anytime you're talking about innovation. Because what happens is doctors are the gatekeepers in healthcare. Let's say you come up with a very innovative medtech device and now you want to go and actually get it adopted. You'll go to the top key opinion leaders of the city or of the country, which are, let's say, it's oncology, for example. You'll go to the top 20 oncologists and go to them and say, look, why don't you try this? And usually, top doctors, top hospitals tend to be quite steeped in their older ways, and they're habituated to the machines or the systems they're already using. And they're very comfortable with the quality they're getting and the experience they're getting. So actually to get a KOL to adopt your new innovation is very difficult. And actually you'll end up breaking your head on doing that. I think if India could create more platforms, like we've talked about how NH has a incubation in-house. If there was a way, for example, we could do this multifold across private industry, across government institutions, I think it would give new innovations a booster shot to really be able to see whether actually their products are useful. And then if there was a platform for other private industry to be able to see the kind of adoption that's been there, I think that would go much faster in terms of the spread of those kind of products. Otherwise, right now, it's very much a game of each company hiring hundreds of salespeople, each of those salespeople going and visiting doctors for the first 4 times of visit saying, no, I'm not interested. And then maybe there'll be a slight crack, opening in the door, and somebody will say, okay, I'll experiment, but I'll not pay you anything. And then, 2 5 years later, somebody will be willing to pay you something for it. So it's a very long journey from that perspective, and therefore again requires a huge amount of seed capital to sustain yourself in that high gestation for adoption.
Any specific advice to entrepreneurs on what they should avoid during their journey?
I mean, I can tell you all the things I did, and there were many mistakes along the way. But I would say two things. One, I would say on a more business front, and one on a more sort of personal front. I think on a more business front, I think most entrepreneurs need to be optimistic, because without optimism, it's very difficult to even start or to get anywhere, right? And honestly, sometimes that optimism is what lands up becoming our blind spot, where we land up making Excel projections and plans, and we think everybody is going to love our product and our service, and everything is going to work perfectly. And if anything we know about building businesses in India is that whatever you think is going to happen, delayed by 2 years. And when you think how much ever you think customers are going to give you business, divided by 1/10. So that has to be sort of the mantra going forward, of saying you have to have enough capital or enough resilience to last longer than you initially thought that you would need to, in terms of getting adoption. And you're going to need, you're going to do less business along the way as well. So I would say that's definitely one thing, is that don't let your optimism become a blind spot. Be very realistic in what you're projecting and forecasting. I would say from a personal perspective, I've always maintained that for entrepreneurs, one of the hardest things and one of the biggest blind spots are their emotions themselves. Because our organizations land up becoming a reflection of who we are as entrepreneurs. If I'm a very impatient person by nature, my organization will become very impatient in nature. If I'm very impulsive and I don't do much planning as an individual, my organization will reflect that value as well. So I think watching ourselves as entrepreneurs, doing our own self introspection, keeping on tweaking ourselves like we do with cars, keeping on fixing, is actually a very important part of building the entrepreneurial balance that is needed for an entrepreneurial success. Because without balanced emotions, if you are somebody who, let's say, gets a lot of anxiety, anything happens and you get anxious about it, that anxiety is going to then cause you to make poor decisions, which is going to land up impacting your organization. So how do you come to a place of equilibrium, of equanimity, of balance, of nuancing your own emotions, which don't overwhelm you? I think is a very important part of building your entrepreneurial journey.
Would you like to share about how Metropolis looks at new startups and new technologies? Is there a way for entrepreneurs to approach an evaluation pathway?
So usually, obviously, because I've done a lot of things in the industry, and also, often people reach out to me for some sort of mentorship or guidance. Often right now, startups will connect with us directly, where, we'll take sort of a instant view on whether we believe something can actually work well within our ecosystem. Metropolis's thought process is more about saying that, look, we are happy to be the platform that allows you to come in with us, work with us, and actually in sort of ways also become an entrepreneurial venture, where we're happy to take equity, and we're happy to some percentage of equity, not a buyout, but also then happy to give you the platform of using Metropolis's customers, brand, and all the other benefits that come with it, where you are actually working as an entrepreneur within a larger framework. So you almost have the security of finances and funding. You have the security of adoption, because our customers, who would normally use our brand, would easily be able to potentially move over to this new product or this new service. So the two biggest problems in healthcare, we actually solve upfront by providing them a space to become an entrepreneur. But obviously, we want the entrepreneur to continue having equity and driving and running this venture in an entrepreneurial fashion within the Metropolis parent for years to come. And if we find those kind of partnerships, then we find that usually they're mutually beneficial to both.
Any areas of preference where entrepreneurs or startups can pitch?
I mean, look, I think anything that becomes a cross-sell opportunity to Metropolis customers is a no-brainer. Anything that becomes an instant, differentiator as far as the way we do business becomes a no-brainer. Something which is a cost reduction in something insignificant, not something very significant in the company, probably would not be as interesting. But of course, it was something very significant in the company, it would be interesting. So I think it's all about with what scale can your product or service impact the existing Metropolis base and customer. And it's not always about numbers, often it's about differentiation. So for example, if you had a product or a service that allowed Metropolis to be different, which would build the brand in a certain way, that would be interesting as well.
So I'll open it up for the audience for questions. There are two so far. While I take them on, there is time for maybe a couple more questions. People can type it in the Q&A window. One question that's come in, Ms. Shah, is would you see business management should be established as a profession with a separate code of conduct given its expertise, just like doctors and lawyers?
Code of conduct for sure. I mean, if you actually study business abroad, ethics classes are always included in every major and every degree. Having said that, I find business as well as the ethics of business not coming from the workplace or from the educational curriculum. It's something that you imbibe, at least the ethics of working, you imbibe from an early stage or you imbibe from your early teachers. If you land up working in good organizations where integrity and other code of conduct is firmly established, it helps you a great deal in your future career. But if you start working initially in your early influential years with sort of more fly-by-night operators and different ways of working, then unfortunately that becomes a part of your DNA. So I think it's up to each of you to really choose what kind of brand you want to work with initially to get that kind of value embedded in your systems so that you know what kind of journey you want to follow. And I think that's a very critical part of building business for general. There are many business management programs across the world, but I have never so far found any, not that I've tried all, but I haven't found any which is truly gives you a flavor of what it means to be practically on the ground as an entrepreneur building things. I find most of these programs are useful after many years of actually being an entrepreneur versus initially.
The next question from the audience is, what are your views on National Digital Health Mission and how Metropolis intends to work in tandem with the mission?
So I've been a part of the close committee of few of us from the private sector who are working very closely with PM Office and NITI to drive the National Health Digital Mission. So I understand exactly what's going on there. I believe it has the opportunity to be transformational in a very structural way in healthcare. If the recommendations that have been given are actually implemented in terms of having a sort of national highway for data, which is interoperable, where people can plug in with their existing systems and be able to send information to a central repository, which then becomes a unique identifier for each Indian in terms of a health record. This can be truly transformational in the way we treat patients. Of course, time will tell as to how and when and where and in which direction this gets implemented. But I do believe that if India does this today, in 5 years from now, we stand a much better chance at being a country who can uphold a very much stronger health ecosystem going forward.
The next question is about the form of capital. So what is the form of capital that you recommend for startups once they're clinically validated? Mostly until that point, they take in grants. BARAC is a primary granting agency in the country, and there are more. But what is your idea? What's your input for the form of capital that startups should take?
Look, I mean, I think the options are unfortunately few. It's not like there is a whole list of options available. So, it's not like there's going to be some 20 options that we can go through. The reality is that for most startups, you have obviously capital from friends and family initially till you're able to get off the ground. There are VCs available who will then fund. As we know, private equity, VC funding are the most expensive kinds of capital because they land up taking the most risk at an early stage. And I believe that's okay. I think often we look for the cheapest rate or the cheapest price for something, and we don't pay enough attention to the risks if things blow up. And this comes back to my first point about optimism being a blind spot. When I have done my planning anytime in terms of capital, I always look at the positive side and I also look at the worst case scenario. And I then make a decision about what kind of structure of capital I want to go for. It's easy to say take debt and drive it because that is the cheaper form of capital compared to equity. But the reality is your startup is high risk. And if it doesn't do well, you are then saddled with a huge amount of debt, which you really probably don't want at the age of 25. So I think the best form of capital initially is the seeding from friends and family, moving on to VC firms who are established and who have a good reputation to be able to support you. If some of them have operating partners who are able to give you mentorship rather than pure, dumb money, as we call it, which is just money, then obviously that is more useful in terms of having that kind of mentorship or that kind of incubation support to help you sort of move along a little bit faster.
There's a question from a fellow doctor on the audience who asks, how would you say a doctor transitions to being an entrepreneur? Because they mostly know the clinical part, they don't understand engineering. Well, if I were to preempt an answer, I would say, please come to the Technology Business Incubator at Mahendra Shah Foundation. But this is a question for you, Ms. Shah.
Yeah. Look, I mean, I think honestly, I think doctors themselves are natural entrepreneurs. I say this because today we have hundreds of thousands of doctors across the country who are running their own practices, and that is their own entrepreneurial venture in their own way. My mother, who's been a gynecologist obstetrician, has run her own practice for 35 years and has done it very successfully, having to take care of everything from revenue model to patient care to administration to HR to IT to everything, right? So I think these are all examples of entrepreneurial ventures. The question comes in is not in starting a doctor's practice. The question is, how do you scale a doctor's practice to moving beyond the individual's name to becoming an institution? And I think the answer there lies in actually first the doctor feeling secure enough that if they move from being their own individual name, Dr. ABC, to instead standing for Metropolis as an institutional brand, for example, they don't lose relevance or they don't lose patience. Or usually I find often there is sometimes an insecurity that, look, if my name is not predominantly out there, do I lose relevance? And I will not have any value anymore. I think that mindset has to be the first thing to change when you're trying to move from being individual brand led to institution led, because then you have to think about the organization as a whole and not you as an individual, because then the organization has to take priority over the individual. And there are many such changes which will have to come along the way, because the team members that you attract have to also feel like they are valid in your institution, which means if it's only named after you, then why would they join you? So there are many such things of moving away from the individual to the institution is the first step, I think, to go from becoming a doctor-led practice to becoming an entrepreneur who can scale a doctor's practice to an institution.
There's a question about Metropolis. How do you intend what's your plan for point of care diagnostic? Does Metropolis have a strategy, and would you like to share for point of care diagnostic?
So currently, point of care diagnostics is quite still limited in nature in terms of the competition with existing chains like ours, right? where you see it mostly used for sugar testing, you see it for pregnancy, you see it now even for a little bit for cholesterol, you see it for many tests, and those have been existing actually for a long time. This is not a new situation, and these are all things which can be used by patients themselves. Then you obviously have a range of point of care which can be used in doctors' clinics, and then you have a range of point of care which can be used by nursing homes and hospitals. And each of these categories of point of care have different strategies. So I won't go into the details of all of them. But in general, in principle, we are used to adopting one of the three or all three in our business existing business model as an ancillary to what we're already doing. So if there are interesting proposals from a POC perspective, we would be open to that.
Great. I see the most popular question that's being asked here is how can a startup pitch to you? On that note, I'd probably end by saying we indeed did crowdsource startups who want to pitch to Ms. Shah, and actually at the end of this session, a curated set of startups will be having a closed-door interaction with Metropolis. I'm hoping by popular demand, maybe we may have another session with you, Ms. Shah, maybe on another topic. On that note, maybe we could end this very interactive session. The audience, thanks to the audience for being very interactive, and thank you, Ms. Shah, primarily for sharing your journey and your perspectives on Indian healthcare and what's the future for Metropolis and for universal health coverage as we see for the country in what's been one of the most challenging times of our lives in the last 8 months or so. And wishing you the best for Metropolis and for all the fellow entrepreneurs who are on this webinar. We will connect back with a curated set of startups with interaction. Thank you, everyone.